Hello people, this is Dr. Muskaan this side, and I'm going to share one case, and this is really very nice case because I've learned a lot on this case. So yeah, let's start this case. Here is 45-year-old male who has came to ER in the hospital with the chief complaints of pain abdomen since 5 days, unable to pass flatus feces since 4 days, fever with chills since 8 days, and nausea since 8 days. On arrival, ABCS was done, airway was patent. On breathing assessment, respiratory rate was 20 per minute, SpO2 was 95% on room air. On circulation assessment, pulse rate was 96 per minute and BP was 130 by 86 mmHg. So from all this assessment, we came to know that ABC was good. Sensorium was also alert, my dear friends. It was E4, V5, M6, that is 15 by 15. Now HOPI. Patient was apparently asymptomatic 8 days back when he developed pain in abdomen, which was gradual in onset, non-radiating, dull aching in character, associated with unable to pass flatus and stools since 4 days. Patient also complains of fever, which was intermittent in character, gradual on onset, associated with chills, relieved on taking medications, and it was also associated with oral bleeding. Past medical history: there was no history of type 2 diabetes mellitus, hypertension, epilepsy, thyroid, seizures, asthma, coronary arteries, or any other comorbidities. Past surgical history is non-significant. Personal history: he has mixed diet, sleep habits are normal, bladder habits are regular, bowel habits are not normal. He's feeling constipated since 2 days. He's BD smoker. He has addictions of BD, smoking 45 per day, and tobacco chewing also since 20 years. On examination, decubitus of the patient was intubated. He was not oriented to time, place, person. He was unconscious, and GCS was 3 by 15 because the patient was shifted from ER to ward to ICU, and when the indication of bringing patient to the ICU was oral bleeding present. Vitals of the patient at present in the ICU are: the patient is hypertensive because BP is 191 by 87, respiratory rate is 26 per minute, that means patient is tachypneic because normal lies between 12 to 18 per minute. Heart rate is 92 per minute, which is normal. SpO2 is 96% on AC/VC mode. IE ratio is 1:2 and PEEP is 6. Parallel icterus edema are present. Clubbing cyanosis and lymphadenopathy is absent. On systemic examination, CNS examination, GCS was 3 by 15, CVS loud, S1 S2 present, respiratory findings bilateral creps with bronchi present. Per abdomen examination, shifting dullness and fluid thrill was present. When I have seen the investigations of this patient, there was anemia, thrombocytopenia, increased urea, creatinine, uric acid, hyperbilirubinemia, serum transaminitis, hypoalbuminemia, and increase in alkaline phosphatase level. ABG shows respiratory acidosis. Chest X-ray shows homogeneous opacity in the lower lobe of the lungs, both in right and left. Ammonia level was also raised. It was 89 micromole per liter. Normal is 9 to 30 micromole per liter, and if the ammonia level is raised, it is suggestive of hepatic encephalopathy because ammonia is the main culprit for the this disease, hepatic encephalopathy. Now, serum amylase level was 211 micro per liter, which is almost 2 times its normal value, and serum lipase was 1263 micro per liter, which is 4 times its normal value. And we can think of pancreatitis because when serum amylase and lipase value is 3 times, then it is pancreatitis. But here lipase is 4 times and amylase is 2 times, so we are thinking on that line, but it is still in query. Typhi.IgG is positive. Dengue duo NS1 antigen is positive. Hepatitis B antigen, HCV, HIV 1 and 2 are non-reactive. ECG shows tall T waves. Ultrasound shows moderate hepatomegaly with grade 2 fatty liver, thickened gallbladder wall, and mild ascites. Further, shock index is 0.55. which is less than 0.6, which shows there is no shock. Sepsis protocol, SIRS, there was hypertensive hyperthermia, that means 2 positive SIR, and there is infection also. There's no infection because TLC level was normal, the lactate level is also normal, so we ruled out sepsis. Now then I checked the symptoms of dengue shock syndrome because हमें dengue fever पता चल गया था है, हमें ये पता चल गया था कि डेंगी हेमरेजिक फीवर है. वाई डेंगी फीवर है ना, अलग अलग होते हैं ना, डेंगी फीवर होता है, डेंगी हेमरेजिक फीवर होता है, फर्दर डेंगी शॉक सिंड्रोम होते हैं. सो कहानी डेंगी शॉक सिंड्रोम तक पहुंच गई है क्योंकि हमारे पास फीवर है, थ्रोम्बोसाइटोपिनिया है और हेमरेजिक मतलब ब्लीडिंग मैनिफेस्टेशन है, ओरल ब्लीड. नाउ वी आर सर्चिंग फॉर डेंगू शॉक सिंड्रोम. सो आई रूल्ड आउट डेंगू शॉक सिंड्रोम. हाउ? बिकॉज tachycardia was absent, cool extremities were warm, there was decreased capillary fill time, that was also absent, weak pulse नहीं थी, lethargy भी नहीं था, pulse pressure was also normal. pulse pressure के कैसे निकालते हैं, SBP माइनस GBP, तो वो वाइडन था, बट डेंगी शॉक सिंड्रोम में कम होता है. हाइपोटेंशन भी नहीं था, DBP भी बड़ा नहीं था. सो ओवरऑल मैप भी अच्छा था, 65 से ज़्यादा था, तो गुड सेरेब्रल परफ्यूजन. तो एट लास्ट डेंगी शॉक सिंड्रोम तो नहीं था. सो व्हाट वर द पॉजिटिव फाइंडिंग्स इन माय पेशेंट टिल नाउ? फीवर, थ्रोम्बोसाइटोपिनिया, ओरल ब्लीडिंग वाज देयर, विच इज़ अ ट्रायड ऑफ DHF. तो डेंगी विथ वार्निंग साइंस इज प्रेजेंट, नो DSS, नो डेंगू शॉक सिंड्रोम. डिरेंज्ड LFT था, फर्दर एमोनिया भी बढ़ा हुआ था, सजेस्टिव ऑफ हेपेटिक एन्सेफलोपैथी, सेकेंड डायग्नोसिस. थर्ड वॉज कि इसका यूरिया, क्रिएटिनिन, यूरिक एसिड बढ़ा हुआ था, तो जब मैंने GFR कैलकुलेटर से इसका निकाला था, इट कम्स आउट टू बी 16 ml per minute, विच सजेस्ट स्टेज 4 ऑफ किडनी डिजीज. कॉकक्रॉफ्ट गोल्ड फॉर्मूला से निकाला था, दैट ऑल्सो सजेस्ट 25.2 milliliter per minute ऑफ क्रिएटिनिन क्लियरेंस, सजेस्टिव ऑफ स्टेज 4 किडनी डिजीज. SIRS है, दैट इज systemic inflammatory response syndrome, which is also 2 positive, that is hypertension and hyperthermia. Serum amylase, serum lipase, suggestive of pancreatitis. Dengue NS1 antigen test और टाइफाइड और दोनों पॉजिटिव थे. तो टिल नाउ overall diagnosis is dengue with warning signs, with thrombocytopenia, with MODS, suggestive of hepatic encephalopathy and CKD stage 4. So at last I want to tell you that what are the dengue warning signs. There are total 16 signs, and 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and 10 signs were present in my patient. Abdominal pain present, persistent vomiting present, persistent diarrhea, mucosal bleeding manifestation present, lethargy, restlessness, hepatomegaly more than 2 cm, hepatic encephalopathy, impaired consciousness, ascites, pleural effusion, shortness of breath, thrombocytopenia, more than 20% rise in HCT since admission, hypotension, ECG changes. So these are the dengue warning signs. I really enjoyed learning on this case, and that's all. Dr. Muskaan is signing off now.